In Yorkshire, someone's diagnosed every 17 minutes. I wouldn't be here today if I hadn't done exercise. I firmly believe that.
I enjoy so much time with my grandson. I just wanted to be here a bit longer to see him grow up.
I underestimated the chemotherapy side effects, and I said, what can I do to get fit? And at that point, one of the GI nurses said, well, there's a scheme just starting in Attercliffe. It's only just started. We'll try and get you on that.
Back in 2015, so quite a long time ago, we started looking around the world about where is having better cancer outcomes than Yorkshire, where is having better outcomes than the UK as well. And back then we were starting to see some studies appear, mainly in the US and Canada, around exercise after diagnosis. Yorkshire didn't have anything like this. It didn't have a systematic programme. It wasn't about a dose of exercise to give you those better chances.
Most of the research early on with physical activity was on the cancer prevention side, whether exercise could lower the risk of cancer. But there was very limited research after you were diagnosed with cancer. So about 30 years ago, I started looking into that area, initially in breast cancer, but have expanded out to many other cancer groups, including prostate, colon, lung, and also initially looking at it more on the survivorship side after treatments, but then becoming interested in exercise during treatments and before treatments.
One trial I did was looking at the role of exercise during chemotherapy for women with breast cancer. And 100 women got the exercise and 100 women didn't. The 100 women who got the exercise, they could walk further, they were doing more active daily living, they had less depression, less anxiety, and less fatigue. And fatigue's one of the biggest things that people with cancer say that they have. We followed up those 100 women, and even 5 years later, they were still benefiting both physically and psychologically.
Some patients, once they finish treatment, are concerned about some of the risks of their cancer recurring or their cancer coming back. And we now know that physical activity for some cancers can reduce that risk by up to 50%.
If you're interested in the outcome of recurrence and the disease outcomes, there's a number of biological mechanisms that have been documented. Probably one of the most important ones is improvement in the immune system, in T cells, natural killer cells, how they track down cancer cells, the number of cells that get distributed throughout the body. Exercise also has anti-inflammatory mechanisms. Inflammation is a factor that influences the growth of cancer cells. And there's a lot of other mechanisms as well.
In the past, it was typically the case that cancer patients were told, rest is best, that it's really important when you're going through your treatment that you should conserve your energy. We now know that's not good advice. And actually the advice now is that all cancer patients, where possible, should really be encouraged to do as much physical activity as they can. It's really important for recovery and it's really important for patients' mental health as well.
Canada, Australia and America do have some physical activity and exercise embedded within their healthcare systems. We do have physical activity guidelines for those with chronic conditions related to those with cancer. The challenge we face here, I would say, is that we have the NHS and it's not as easy to incorporate these things because of cost.
There's so much that we can do where you combine expertise, where you bring in clinicians, where you bring in sport and exercise scientists, you bring psychologists, you bring designers together. The collaborative nature of that, working with patients, means that you get the best outcomes.
We really do know now that physical activity is really imperative if you want to live a long and happy life. It can really help in terms of reducing your risk of dying early.
Having visited and had my first visit with the surgeon and the upper GI team at Northern General, the consultant surgeon said, if you don't get fitter, you will not be fit enough to survive this surgery.
My name is Neil Garner and I've been a cancer patient. At a certain age, everybody becomes aware of the possibility of cancer. My family's attitude is if you've got the opportunity to test, you test, which is what I did. And within 2 days of returning the kit, I was contacted by the cancer team at Ecclesfield in Sheffield.
I was diagnosed 1st of December 2015 with HER2 positive breast cancer, and it was 3 tumours. I went on a 12-week programme which focused on health, nutrition and exercise. So we had tasters of different kinds of exercise. It made me stronger for the next round of treatment. I just thought, there's only me that can own this. If I have exercise, that's going to improve my health and I can recover quicker.
In the beginning, yes, I was apprehensive, and it's only because I didn't know about what the benefits would be.
The visits here with my trainer became the highlight of the week. It was pushing me to achieve something that I knew I'd got to achieve. The exercise made me feel fit, and it made me feel as if I was in control of my own destiny, because it would make the operation quicker, safer, and I could beat the cancer.
I think one of the biggest challenges is trying to really encourage and motivate people to be physically active, and it's a challenge because we know there is lots of really important health benefits, but trying to get people to adhere and stick to physical activity over a lifetime can be quite challenging and quite difficult. It's not easy, but the benefits are large, and it's really important in terms of making sure that people live long, happy lives.
Exercise does not have to be all in one go. They can break it down into 10-minute chunks.
I'd never been in that situation before where somebody was going to assess me for being fit enough to have this surgery. But also, I'd never been in the gym before. The last proper training I did was I ran a marathon in 1983.
Okay.
And I vowed I'd never do another one ever.
Yeah. Patients, when they first come along to the service, are seen and assessed by a physiotherapist. They're trying to understand how they are, what they're able to do, what's limiting them, and to work with them to develop a plan. We're looking to see patients who are at risk of deteriorating or who are at risk of harm, and we can offer the right level of support for them. Do they need to see a specialist in the team? Can they join a group and get that wider level of support, or there is somebody who can go on and do things for themselves?
If you think about it like a marathon, you wouldn't just rock up at the start line with your trainers and go, let's see what happens. You'd do some preparation. You'd put in the hours, you'd get yourself as ready as you possibly could. And exercise, therefore, is a key part of that when it comes to cancer treatment. It's multimodal, and what we mean by multimodal is it includes physical activity, nutrition, and psychological support.
And it's a bit like a three-legged stool, really. If you are struggling from cancer symptoms, cancer treatments, and you can't eat well enough, then you can be undernourished. Our patients can be undernourished. As a result of that, you've got low energy. But also it's likely that might have an impact on your mood, because it can be worrying and might make you anxious.
I found that a lot of the patients I've spoken to, especially patients who have had chemotherapy, really struggle to go back out into the outside world. Structured activity can be really helpful and give people the social support and the guidance that they need and often seek.
I was going to get myself back to that fitness that I was pre-op. And again, the people that you're talking to know what you've been through.
It takes the people around you. You need to have the guidance and the expertise from the Active Together team. You need to have family support. It's all of it, isn't it?
All of those make up a big jigsaw.
Yeah.
When they all fall in line, it clicks.
Yeah.
Get off your settee and go out through the front door.
Yeah.
And basically, that's the biggest challenge.
Yeah.
after being diagnosed, it was essential that I got fit. I looked around and couldn't find a group that did what I needed, so I decided to set up the Mid Yorkshire Breast Cancer Support Group.
Good afternoon, ladies. So most are quite familiar faces, a few new people, so welcome. So we're just going to do about 20 minutes of Pilates today. So I thought we'll obviously make it very focused towards breast cancer rehab. As you know, after surgery, sometimes you can feel really tight through kind of the pecs, you know, you feel like you're losing a little bit of strength. So we'll do a little bit of balance work. We do Pilates to encourage balance, strength, help combat osteoporosis, things like that. When people have been through a cancer diagnosis, then often they'll be frightened that if they move in a certain way, that might exacerbate their condition. And I think for most of them, they said that it's just been their mental well-being has felt so much more supported, that they're not going through it alone, that there's other people.
It was just so joyous to see people growing, getting stronger, and understanding the importance of mental health as well as physical health.
I used to be very active. Well, after having my breast cancer and after having my surgery, I felt very depressed because I wasn't as fit, and I think I was sort of shouting at myself, if you like, because I wanted to be where I was before. Well, I feel better in myself, a lot better since doing this.
Sometimes the greatest thing that people get out of it, just that support mechanism from other ladies.
The patient voice has been so listened to. The very thought of exercise being available in so many areas of Yorkshire is just music to my ears.
Ultimately, everybody who has a new diagnosis of cancer should be offered a place on an exercise programme. One of the most significant benefits is going to be taking strain off the NHS, because you've got fitter patients who need fewer interventions. Drugs are so expensive, the cancer drugs are so expensive. If you can prevent cancers recurring, you're also preventing cancer patients needing even more expensive drugs, therapies, treatment, surgery in the future. Cancer is not going away, so we absolutely must find the very best ways of treating it and be more effective at treating it, so that our populations generally worldwide can deal with cancer more effectively.
It's been 30 years since we started this research, but really, early on, we didn't know if cancer patients could exercise during chemotherapy. We didn't know the feasibility and safety. And it's taken a long time and a lot of researchers to establish that. So I think we're really at a phase now where we can begin to roll this out with almost every organization.
In the future, I would like to see physical activity programs, multimodal prehab and rehab programs as a core part of treatment.
At the moment, most patients aren't routinely encouraged or recommended physical activity. And I think if we could get more cancer care professionals to raise the topic of promoting physical activity, then I think, cancer patients would be more encouraged and have more confidence to take part in physical activity than is the case now.
You would never hear a consultant oncologist saying, now would you like a little bit of chemotherapy, yes or no? Well, it should be almost the exact same with exercise. It should be, because of the overwhelming evidence, part of the care. Going from that to actually doing it requires appropriate guidance and support, so that somebody in the middle of chemo doesn't feel that they're actually going to be completely pushed out of their comfort zone.
We've got to innovate, we've got to try stuff. We've got to try things that are co-produced with patients, co-produced with clinicians, co-produced with researchers. We need to start to design these services with scalability in mind.
As much as we can, we want to take these services near to patients, to have it on their doorstep. It means that we're starting to take out some of the health inequalities that can exist, so that we're supporting the people who need it most.
And maybe that's the next challenge, as to how do we start to scale these programs so that, irrespective of where people live and the conditions in which they live and work, they can get access to programs.
Why would we wait? Why would we wait any longer when we can see the evidence is so compelling from around the world, with international experts telling the same tale, that exercise is a fantastic additional treatment for cancer patients? It's time to do it now.
I believe that exercise should be available for all cancer patients. The NHS have also got to adopt that attitude that it's important for cancer patients to exercise. And from the first day of diagnosis, GPs and clinicians should be saying to the patient, exercise is needed.
There are some standout moments on my cancer journey. Obviously, being told we can't do anything else for you, you'll die of cancer or you'll die of heart failure, I couldn't accept that. Only having a 40% chance of living 5 years, that drove me. I had to get fitter, I had to be active.
Exercise has helped me to recover quicker. So I knew if I got fitter, got strength in my legs, I could then carry on. And now I can see that the link between being positive, exercise and support is what will make me live another 20 years. If you like, you could call it hope. Where there's hope, there's life.